And it's that time of the morning. We are talking to our resident medico, Dr Clara Chu, who has joined us. Good morning to you, Clara. How's things?
Yeah, going well, thanks, Mick. Thanks for having me.
Hey, it's always a pleasure. Love looking forward to these chats that we have, and I know a lot of people benefit as well, which is obviously the point of it. So, now today is a pretty big topic as well, very, very common in society. This one, it's osteoporosis. So let's jump in this morning. Can you tell us exactly what is osteoporosis?
Well, before we get into the medical definition, let's go to the origin of the word, which will help us work out what osteoporosis is all about. And I also love, that origin of word thing. So we need to actually break down osteoporosis into its three components, which is osteo, poro, and osis. So osteo comes from the Greek word osteon, which means bone. Poro is also a Greek word, poros, meaning porous, and osis is, again, also from Greek, and it means abnormal condition. So if we put all of those things together, osteoporosis is an abnormal condition in which the bones are porous or weak, and this can result in crushed fractures in the spine or in more obvious fractures in the hips and in the arms and in the legs.
Yeah, I felt like we were about to jump into a Greek biblical study there for a minute.
Yeah, almost, but not quite.
It's what I'm kind of used to doing. So I'm like, oh, okay, we're learning something different today. So who gets osteoporosis and how common is it? Because we do hear that term a lot.
Yeah, you do. So osteoporosis affects men and women of all races, but white and Asian women, especially older women who are past menopause, are at the highest risk. So osteoporosis is a very common problem in Australia. There's about 1.2 million people that they're estimating to have osteoporosis, and then a further 6.3 million with low bone density. So considering that the population of Australia, I think, just hit 27, that's like roughly 1 in 4 people with low bone density. So
Wow.
that's pretty staggering. And then of those who are aged 50 years and over, 66% have osteoporosis or osteopenia. And so there are over 183,000 broken bones each year due to poor bone health.
Wow, that is quite a staggering statistic, isn't it? You often hear as well of, particularly the elderly, having falls and things like that, and they don't really recover, do they? Which is really tragic.
No. Yeah, and there are stats around that kind of thing as well, where poor recovery from osteoporosis, after a fall.
Yeah. So how is it diagnosed?
So osteoporosis is diagnosed with a bone density scan. So sometimes it's referred to as a DEXA scan, a bone density test, or bone mineral density test, or by the medical name DXA test or DEXA. So it's a simple scan that measures the density of your bones at the hips and the spine. So that's kind of where most of the impact seems to happen. So the test uses X-ray to measure how many grams of calcium and other bone minerals are packed into a segment of bone. And there is a small amount of radiation exposure from the scan. It's equivalent to about 1/30th of the amount of a chest X-ray. So you need 30 of these bone scans to equal a chest X-ray. Or for those who fly often, it's equivalent to the amount of radiation that you'll be exposed to a flight from Sydney to Melbourne. But again, it's requiring 30 of those flights. So, the amount of radiation is pretty small. But back to the DEXA scan, it's a quick and painless procedure. You lie on a flat padded table, and the arm of the machine actually passes over your body quite a distance away, so it's not claustrophobic at all. And the scan takes about 10 to 15 minutes. So obviously, depending on the protocol where you get it done, some places will let you remain completely dressed, others will get you to change into a gown, and then the test results get sent to your referring doctor.
Yeah, good. Well, that is good because sometimes you see people being slid into the machines, and I think a lot of people have that in their head. So to have something like this, where you're kind of a little bit more out in the open, is I guess a little bit more comforting for people. So the next question is really, who should have a bone density scan?
Yeah, so the recommendation is that women and men over the age of 50 with risk factors for osteoporosis need a bone checkup with a DEXA scan. Younger adults with certain risk factors may also require a test, and this will be determined by their doctor, obviously. Now, Medicare currently covers for bone density scans under certain conditions. The list is quite long, so I won't be boring you or our listeners with all the details, but essentially there's a Medicare rebate on bone density scans if you're over the age of 70, or if you've had a fracture that's caused by sort of, minor trauma, or if you're monitoring for osteoporosis proven with the previous bone density test that you're low, you've got low bone density, or if there's a whole heap of medical conditions where it can affect bone metabolism. So, in short, your GP will be able to tell you whether you're eligible for a Medicare rebated scan. Now, if you don't fit into any of those eligible criteria, you are still most welcome to go and get a bone density scan done. But just note that you will be charged a private fee. That fee, from what I've been told by various people, is probably just under $100.
Okay, so not too bad.
Again, no, but again, depends on where you go. So,
Sure.
but we're looking at around that kind of ballpark, considering that, a private MRI scan can be, $200 to $300. A private bone density scan is, sitting sort of around or just under 100.
Sure. So if people do have the scan, what will it tell them?
Yeah, so I mean, this bit normally, would be done better with graphics, but we're on a medium without any visual, so we'll have to try and explain it. But a bone density scan will essentially tell you if you need to take any action to protect your bone health. And the results will come out on a pretty graph that's got 3 colors on it. And so it will indicate whether your bones are in the range of normal, which will be usually showing up as green, low bone density, also called osteopenia, which is in yellow, or osteoporosis, which is in red. So it comes up as a bit of a graph for you. And if your bone health is normal, then maintaining adequate calcium, adequate vitamin D, and exercise is still really important. But if the results show osteopenia, which is the low bone density, or osteoporosis, which is very low bone density, then it's essential that you take action to protect your bones. We'll talk about that in a little while. And improvements in bone density and bone health can be achieved over time. So it's not something that just because you're diagnosed with it now that you're potentially stuck with it for life.
Sure, that is great news. We are speaking with our resident medico, Dr. Clara Chu, this morning on Rhema Brekky. Make sure you stick around. Plenty more to come with Dr. Clara right after this. Welcome back. We are chatting with our resident medico, Dr. Clara Chu, this morning, and the theme this morning is osteoporosis. Again, it is a huge topic, so we're trying to get as much in as we can this morning. Now, Dr. Clara, how can osteoporosis be treated? This is the thing that people want to know.
Yeah, absolutely. So there are a range of treatment options available. Now, in terms of medications, most medications work by slowing or blocking the activity of bone-removing cells while leaving some of our bone-forming cells at work. So bone is being turned over all the time, and we've got some cells that are, taking bone away while others are sort of laying down new bone. So by doing that, this will help improve bone strength over time. And so osteoporosis medications are commonly prescribed over many years. And of course, they're always approved by the federal government before they're used in Australia. And there are 2 main types of these medications. Both of them slow down bone loss, improve bone density, and reduce the risk of fractures, which is ultimately what we want to do.
Sure.
So the first group is called bisphosphonates. They can be given in the form of tablets that you take either once a week or once a month, or as an infusion that you get once a year, which is usually done in a hospital. Then there's a second type of medication, and the drug name is called denosumab, and the brand name is Prolia. So a lot of our our clients may have heard of that. And so this is given as an injection under the skin every 6 months. And usually, the doctor or the practice nurse will do that for you. And so all of these options have been around for a number of years, and they have been shown to be quite effective in improving bone density and reducing fractures. Now, in certain patients, menopause hormone therapy or selective estrogen receptor modulators, so that's a bit of a mouthful, but they act on estrogen, which can help with bone density as well. So that can also be prescribed, but it depends on a very specific set of circumstance. Now, obviously, some people are not super keen on medications because medications often have side effects and things. So, there are some staples to improve bone health, which are calcium, vitamin D, and exercise. So let's start with calcium. We all know that calcium can be found in dairy products. But for those people where dairy is not quite their friend, some good non-dairy sources of calcium are fortified soy milk, sardines, firm tofu, salmon, sesame seeds or tahini, kale, chia seeds, and almonds. So there's a whole range of foods out there that, that we can commonly eat or add to our diet that would help with calcium on top of dairy products. Females age 18 to 50 need 1,000 milligrams of calcium per day. And for those who are 51 or older, they actually need more. They need 1,300 milligrams of calcium per day. And then for men, the age brackets are just a little bit different. So the numbers are kind of the same. So those who are 18 to 70 need 1,000 milligrams of calcium per day. And then those who are 71 and older need 1,300 milligrams of calcium per day. So, we just need to make sure that people are actually receiving adequate calcium through dairy products and other non-dairy sources. But let's move on to vitamin D. So vitamin D, the cheapest source of vitamin D is sunlight. But Australia has the highest melanoma rate in the world. So while sunlight is the easiest, the most efficient, cheapest source of vitamin D, I think that it's also wise for us to know how else we can get vitamin D apart from the sun.
Sure.
So some of the best sources of vitamin D are salmon, tuna, eggs, and mushrooms. And here's a really interesting one for you. Did you know that leaving your mushrooms out in the sun can increase its vitamin D content?
Well, this is why we have you on the show, Clara, at different times, because we find out little interesting things like this that I would have had no idea about. Now, I'm a regular vitamin D supplementer. I take it pretty much every day. And I love mushrooms too, but I would never ever thought to leave them out in the sun to increase their vitamin D content. I've never heard of that before.
No, so I only just found out about it, I think maybe like about 12 months ago. I've been a doctor for such a long time. And I heard it at a conference. So here's the tip. So you slice your mushrooms to increase the surface area that can absorb sunlight. You spread your slices out on a single layer of a baking sheet or some kind of a flat tray, and you put them out in the sun between 10 a.m. and 4 p.m. when the sunlight's the strongest. And then during this time, there's a chemical in your mushroom that's called ergosterol, which will react with the UV rays to generate and soak in even more vitamin D.
Wow.
So if you're able, leave them in the sun for an hour to maximize nutritional value. But there was a study that kind of studied all of this and said even a quarter of an hour, so 15 minutes, can make a huge difference.
Wow.
And of course, if those foods don't really agree with you or you're not fans of fish and eggs and mushrooms, vitamin D supplements, super cheap in the supermarket. I say to my patients, I often find them on sale at Woolies or Coles every second week practically. So definitely make sure that you top yourself up.
And a quick question, because this is something that I've been tracking for quite a while now, is with vitamin D supplementation, there's a lot of literature now coming out about the role that vitamin K2 plays in that as well. So basically, we want to get the calcium into the most important part of the body, which is the bones, and keeping it out really of the soft tissues. Now, is that a thing that you would also say for people to do if they want to go down that road of supplementing with vitamin D?
Yeah, I've actually seen a few companies now making that combination of supplements. And so, I think the research is still kind of coming through, but I definitely don't think it would cause any harm. So, if your listeners want to give that a try, it might be worth a bit of an experiment to just see, whether that boosts their vitamin D levels adequately.
Yeah. Now, you're talking about exercise. That is a really important one, isn't it?
Yeah, absolutely. So, if listeners have been listening to our interviews for a while, they'll know that, I'm a massive fan of exercise.
Right.
So, I think that being physically active and doing exercise helps to keep our bones strong and healthy throughout life. We all know that.
Yep.
That's because your bones are a living tissue that gets stronger when you use them. So, you remember earlier talking about cells that kind of take away bone and cells that, put down new bone. So, but your bones will only stay strong if you give them work to do.
Sure.
So if you do nothing and you don't stress them out, they're going to become weaker and weaker. So for exercise to be most effective at keeping bones strong, you need to actually combine weight-bearing exercise with impact and muscle strengthening exercise. So this might, to most people, sound like, hang on, what's the difference between all of those things? Hence my next bit of advice. The best thing to do is to get a tailor-made exercise program for you through an accredited exercise physiologist, or EP for short. So EPs are allied health professionals like physios, OTs, dietitians with a university degree.
Sure.
And essentially they've studied human movement and physical activity for 4 years before they get their degree. So, you know, they're very well qualified to, you know, assist people with the best type of exercise for them, because a lot of us think that, oh, we just need to, like, you know, lift some weights, and, you know, that might be like 2 kilos, 3 kilos. We're actually talking about, you know, weights that are much, much heavier than that, you know, without injuring oneself. But this is where the professional comes in to actually help you work out, well, how heavy is too heavy, how much is too light.
Yeah, absolutely.
Because you want to actually get bang for buck for that. And so, you know, I work with EPs at my various workplaces. They're a wealth of knowledge in all things around exercise, and, you know, I love them and I love what they do. Yeah,
definitely getting onto those guys for sure. Now, is osteoporosis a condition that can be prevented?
Yeah, absolutely. So, you know, what we've been recommending for treating osteoporosis, as we've just been discussing, is also what we recommend for preventing osteoporosis. So the 3 basic things: calcium, vitamin D, engaging in regular weight-bearing exercise, you know, with, you know, some kind of impact,
sure,
some kind of muscle strengthening. They're the staples for preventing osteoporosis.
Absolutely. And I guess to wrap up really this morning, what type of care and support is available for people living with osteoporosis?
Yeah, so Healthy Bones Australia is a wonderful website that I've just discovered recently. Lots of information and resources. So yeah, that would be one place that I would, you know, encourage our listeners to go and have a look at. Your GP, your dietitian, your exercise physiologist, they can also be of help when it comes to, you know, which medication is suitable, if that's a path that you want to go down, or if you want to just find out more about, you know, how can I maximize my calcium or vitamin D intake through my diet? And then, of course, with the EP is, you know, bone strengthening exercises. Yeah, can't recommend them enough.
Absolutely. A huge topic, osteoporosis. And Dr. Clara, as always, thank you so much for joining us this morning with just a wealth of information and knowledge that you carry. And it's a real blessing to our listeners, that is for sure. Stay with us. This is Rhema Brekky. More to come right after this.